Now, I mentioned the different systems that people like Sajid Javid are urging us to look at with the NHS. I wonder what you think of this. He's not at this stage proposing out-and-out privatisation, but he is talking about these sort of hybrid health systems that they have in places like Germany and France, which are partly funded through general taxation and partly by health insurance schemes. Let's bring in Ryan Shorthouse, who's chief executive of the think tank Bright Blue. Ryan, has Sajid Javid got a point, do you think?
Well, I think the first thing to say that it is quite brave, really, because politicians, particularly centre-right politicians, have shied away from talking about alternative ways to the taxpayer-funded model we have for the NHS for a long time. And actually Wes Streeting, the Shadow Health Secretary as well, did quite a major speech today saying, the NHS is not perfect, it needs reform. So there does seem to be a space opening politically, which I think is wise, because for a long time, both parties have focused on this idea that you just have to increase the amount of taxpayer funding going into the NHS, and that's what the public want, and that will deliver better outcomes. And I'm not sure, particularly on the latter case, that has really happened. The NHS is taking a higher proportion of public spending. Despite the austerity we saw in 2010s, the NHS really was the only public service department that had real terms protections in their spending, and yet outcomes really haven't improved that much. Yes, some of that's to do with COVID, but generally outcomes across the board are not necessarily that great compared to some of our international competitors.
So he talks about France and Germany, for example. What is so different about a European model?
Well, the UK is actually quite unique in being fully taxpayer funded, whereas actually there are social insurance models in different countries across the continent of Europe, which is quite strange, actually, because mostly, UK is seen to be more sort of, kind of free market compared to Europe. But actually on the NHS, continental countries are, what you might traditionally seen as more on the right. But the idea is that you're contributing to your own healthcare. So rather than contributing through taxes, no matter whether you consume healthcare, you're actually contributing above and beyond your taxes through an insurance model, which then protects you for some NHS services, for some health services. And in my view is that we should be exploring this, because I just don't think it's sustainable to keep saying that the public purse should bear an ever-growing proportion of total spend to the NHS. But also, I think it's not right and fair to keep saying to general taxpayers to contribute more, even when they're not consuming necessarily more healthcare. And I think it's right to think about, actually, maybe we should be asking people who do consume more healthcare to contribute more, but obviously done in a way that protects the lowest earners. So it's still free at the point of use. But for the people who really need it in terms of all of the services in the NHS. But for some NHS services, just like with dentistry, for example, it's not free at the point of use. For most people, they have to contribute, do a co-payment, for example, but the poorest are protected. Maybe we should be looking at that for more NHS services and thinking about insurance models to be able for people to be able to afford that.
And if you had a sort of insurance model where you pay, apparently certain countries pay 7% of their salary towards health insurance, isn't that just the same thing as we're doing already, though? Isn't that just another tax?
Well, yes, it is. And this is why I find it a bit odd when people sort of oppose it, because actually to continue funding the NHS in the way that we do, we have to kind of keep, bearing on taxes, basically.
But then where's the benefit
or borrowing
for it?
More. But the point about this model is that actually the contribution is more connected to your consumption of healthcare. And the point about that is therefore that it makes you think more responsibly about your health to try and reduce the demand or reduce your consumption overall. So I think it's right to think about more linkage between the amount that people put in and the amount that they consume from healthcare. I'm not saying that should be the case for all NHS services, but I'm saying I think more than, for example, dentistry, which you have co-payments for at the moment, we should be looking at other NHS services where people contribute based on, whether they have the financial means to do so, and over a long period of time through a sort of insurance-based model. So it is like higher taxation, yes, but it means that what you put in is actually is paying for what you actually consume. And I think that's the right link.
And is this what some people, though, would say is privatisation via the back door? Is this run by the state, or is this private healthcare?
No, it can still be run by the state. I mean, if the state still owns the underlying assets, then it isn't privatisation, and nobody is talking about that. Still the state would own the underlying assets. At the moment, for example, private companies deliver some NHS services and operations. That isn't privatisation. The state still owns the underlying asset. It's just that some contracts are done by private healthcare. So, I know people on the left for a long time have said, the Conservative government are going to privatise the NHS, but they haven't done that in all the years that they've been in government. So, I think there is a role for private provision of some NHS contracts and services. And the evidence, particularly from Imperial College London, seems to suggest that increased kind of contestability and, different providers competing for contracts can improve outcomes in the NHS. But nobody's talking about privatisation.
So what we are getting, though, at the moment is an element of not privatisation, but people going private, because the backlog is so immense at the moment. We have sort of got a two-tier service, haven't we? Because some people are just paying to effectively jump the queue.
Yeah, and, we have that in a lot of public services. We have that with education as well. But, what should really be the priority is making sure that you improve the public provision. Just like in education, you focus on state schools and making sure you improve standards in state schools. You should do that with the NHS. The focus should be on making public provision of healthcare the best that it can be and the most sustainable, so more people can use it. And indeed, people from modest means can access world-class healthcare. And, generally, I think mostly the NHS offers better services than private healthcare, actually, in many circumstances. Not all, but in many circumstances. There's an issue around waiting times, but generally I think the NHS does provide superior care, particularly around maternity care and cancer care. But, at the end of the day, there is some evidence that if private providers are also involved in NHS operations and services, then that can ease the pressure on the system and also improve results. But, what is important is that whether you have, even if you have a social insurance model, that if people need care, that it should be there and available to them and free at the point of use, if they can't afford to contribute. And as long as we have that system in place where money is no barrier, then, I think we should be open to, private provision in the NHS, social insurance, to make it more sustainable. I think Sajid Javid is brave and right to open up the conversation to new ways of funding it. And after all, either we ask people with the broadest shoulders to pay more through tax, or we ask them to pay more through a social insurance model. And I'd rather do the social insurance model because, as I say, it means that your contribution is more connected to your consumption of healthcare.
So people who are better earners would do this. What about the people who aren't earners at all, or just can't afford to pay any more money for social insurance?
Well, like I say, I think, we should make sure that any service that somebody requires for healthcare is accessible financially. And that means that if someone hasn't got social insurance, is on the lowest incomes, then they should be able to access free healthcare, whatever the type of service, just like with dentistry, that happens at the moment. So, as long as it's means tested, then I don't think it should be, I don't think it's a problem to ask people who can afford to do so to contribute more. That, after all, is what the government tried in 2021 with the introduction of the health and social care levy, which was to introduce a new national insurance to fund greater NHS provision. But of course, that new health and social care levy applied to most taxpayers, but not to all taxpayers. The people on the very lowest earnings would not pay it. And it would be the same with the social insurance model, that the people on the lowest earnings wouldn't have to pay it, and that wouldn't affect their eligibility for free healthcare.
And what would you say to the critics who do say to me, this is all part of a plan, it is to do with privatisation, that the NHS is being deliberately run down so people get fed up with it and want it revamped?
I think that's conspiratorial. I mean, at the end of the day, the NHS is consistently a top priority for the public. And if the government is seen not to deliver the NHS or manage the NHS, or oversee, probably is the right word, oversee the NHS, they will be punished at the polls. So I don't think there's a kind of plot to make it bad and then allow loads of allow private privatization to happen. I just that wouldn't be a sensible political approach. It would cost the government dearly to do that. So I don't think there's a conspiratorial plot. I think there's a kind of genuine openness to new ideas and policies to try and both raise the quality but also the sustainability of the NHS.
So it does feel like, even within Labour as well, that there seems to be a mood for change, that what's there at the moment just isn't working?
Yes, and I think that's really welcome. There's a lot of pride and support for the NHS, quite rightly. But, with all institutions that we love and respect, we can't just, keep them static. They have to be reformed, and we have to learn from other systems to try and improve stuff. The things that we love, if they are to continue to survive and flourish, we have to look at ways of modernising them and creating fresh ideas within them to improve them. We can't just keep the same model all the time. We need to try and look to improve it and ensure it's more sustainable. So I think it's welcome, this debate, because at the end of the day, I think it comes from the right place. People want to try and make the NHS work better and be funded better for the long term.
Ryan, thank you. Ryan Shorthouse there. What do you think then? Do we need to look at European-style models, or is the model fine, it just needs more money? What's the root of the issue? 0345 6060 973. More calls in just a moment. LBC 218.